Okay. So I think we've kind of come to the end of the conversation. And so I just want to let you say a few words, and then I'll kind of end it with something that I want to say. So why don't you give us your last words?
For those of us who are already natural but struggling, I think there are lots of resources out there. Just, you may want to, even if you don't have CCCA, or, you may want to just go to a professional, a dermatologist, or a trusted hairstylist for advice on what the quality of your hair. Do they see any problems? Because I'll tell you, stylists have alerted me to things, or talking to you, Dr. O, who let me know that this is a symptom that could be something serious. And sure enough, for me, it was. So I'll say, if you're struggling and you're already natural, see somebody about it. Maybe you don't need to see somebody. Maybe somebody can help you with the grooming practices. I do find that Black Curl Magic Digital Salon ridiculously helpful. I've read their book called Wash Your Damn Hair Twice. I reference it all the time for advice on styles or products. And if you're not natural and you're afraid, or you're on the fence, I would say I started with just images to see where I could go, or how I could envision myself, wearing my natural hair. So I started with the end product in mind, just like how you set any goal for anything, and then
Sure.
figure out how to get there. So that would be my advice.
Thank you. All right. So first thing I would say is, first, realize that there is a problem, right? Second thing is to understand where you can go for help. Start building your team, right? And your team for a recurrent scalp or hair issue is a dermatologist, a stylist, or a trichologist. If you feel like you have a lot of stress in your life, make sure that you see a mental health professional. If you're not eating properly and you have, diet issues, make sure that that is under control. If you have weight issues, let your hair issue be the beginning of you getting everything together, because we know that the hair is attached to the scalp, which is attached to all of the rest of this, right? So if everything is not in order, it can be very difficult to get the best result as far as how your hair presents itself. Seek a professional early, like I said before. I've created 2 resources for you to find a dermatologist in your local area. One of them is called Docs for Hair, so www.docs for the number 4 and hair. And so you can find a local hair loss professional. And then the other one is called blackdermdirectory.com. So I believe in continuity of care. I think it's really important to find somebody in your local area who knows how to treat you. And there are so many great derms treating hair loss. I mean, Dr. Kindred in Maryland, Dr. Yolanda Lindsay, Dr. Meena Singh. Dr. Kindred actually is the only dermatologist who also has a salon in her practice as well. So, I mean, this is pretty groundbreaking. Dr. Meena, also is a hair transplant surgeon. So there are, Sasha Henry in Haiti, I see her now. I mean, she did like a hair loss fellowship. So there are so many people who do great things all around this planet. And you don't need to come to the person who's doing the live. You need to find the person in your neighborhood and in your locale who you can establish a relationship with and you can go to on a regular basis. It's really, really important. We all need to be able to share the wealth. All right?
So I love it. Somebody said this live is a blessing. That made my day. Thank you so much. It's we've all been there, guys.
Absolutely.
To the other side. And then somebody else asked about shampoo and conditioner. I highly, 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 highly recommend getting that Wash Your Damn Hair book, because that's where I learned about what products I should use. And shampoo is a tool. And they tell you about, what is a clarifying shampoo, what is an all-purpose shampoo, what is a moisturizing shampoo. It's deep, y'all. Get the book, read it. It really, really, really helps, please. And it's an easy read. And because we're all so into it, you can read it very quickly.
I do want to mention one more thing before we go. A lot of times you'll go to the dermatologist and they will tell you all of the things that you cannot do with your hair, right? You cannot do braids, you cannot do weaves. I do think that it's really important for us to be able to give you options that you can do, because it's really upsetting and disappointing for you to walk into a dermatologist and, you know, for them to give you such limited options. So, you know, push your dermatologist to give you, okay, if you don't want me to do this, what can I do? What style can I do that you're going to be comfortable with, that is going to allow you to continue to treat me, that is going to protect my follicles? But girl, I still got to be cute. So what can I do?
Yeah, that's true.
Right?
We
Yeah.
know it quite a bit. Somebody asked again, what's the name of the book? The name of the book is Wash Your Damn Hair. Yeah, somebody just posted it. Wash Your
Yeah.
Damn. By the way, I don't get anything from that.
Nobody.
I paid for mine. You know, I paid
Yeah,
for mine.
I paid for mine. I recommend it to a lot of patients.
Anything I've mentioned here, this is all love, guys, and it's just to share with you what's helped me, and you know, I hope it helps you.
Derm, stylist, mental health professional, personal trainer, get yourself a good team. All right?
Bam.
Guys.
And thank you for being on my team, Dr. O.
Oh, you're welcome. You know I love you. Thank you guys for joining us. It was awesome. We'll stay on for like a few more questions, maybe just a couple more minutes. If anybody has any other questions, I think we tried to answer them as we were going on. Let me see.
The Derm Directory again.
Yeah. blackdermdirectory.com. Can you comb? What?
Can you comb and care? What was that? I missed it. That was interesting.
Comb, and I missed that too, about the transplant. Yeah, the office is open again, but you know, we're seeing patients kind of limited.
The site is, if they're asking about Black Curl Magic Digital Salon. Dr. Frempong, what is
Wig damage your hair? I think they can. You know, oftentimes the undersurface of the wig is quite rough, and if you already have a compromised scalp and compromised hair shaft so that it's weakened, the wig will definitely rub on the hair and continue to break it. So you have to be really, really careful. Now, I know sometimes it's easy to say take your wig off, but okay, what if you're nursing a large area of hair loss in the middle? I think that we can make small compromises to that, you know, wearing maybe some sort of a silk protectant on the hairline, maybe wearing the wig slightly pushed back, but you got to make sure that we protect and preserve the hairline. But yeah, wigs can cause traction alopecia. We see that all the time, particularly when you start to use glue and things like that, that continually like move those tiny little hairs. Even something as simple as wearing a scarf around your head at night, right? If you already have traction alopecia, and again, your scalp and your hair shaft is compromised, wearing that scarf tight at night can also rub on those hairs and break it as well. So
somebody just asked about an age limit for hair transplant.
I mean, we do them on children for like in burn scenarios, but you know, try to like to do it mostly on adults.
And somebody asked about, I think they're asking me what I use to transition, what protective style did I use to transition, and against look at Dr. O giving me the side
MA.
against Dr. O's you know, suggestiones, I use braids because braids had always worked for me. They did not work for my edges, of course, but they always worked for growing my roots or my new growth. But we did compromise where I did not braid my edges. So I wore the style down so that it would cover my edges as they were growing back after my transplant. And we compromised where I used human hair for my braids, which I got from Lugo's Hair, which I think is very reputable, and they're very good about advising what hair is good for braided styles or what have you, what you'd like.
Braided your hair a little bit first, and there was no tension, right, on the underneath.
So I would always hold.
Yeah.
The woman who braided my hair, her name is Amy, and she's at a salon in Harlem, and she was really great because literally every braid she did, and I usually did like the Senegalese twist. So every twist she did, she would say, "Is it okay? Is it okay? Is it okay?" And if I said it was too tight, she would redo it. So we had a really great relationship there.
Okay. Okay. Hair transplants are not covered by insurance, unfortunately. Sorry about that. Yeah.
Plan, Dr. O?
Huh?
Is there some sort of payment? I know I paid for mine, but is there a payment plan?
It depends on the clinic that you go to, but not at our. Some people take care credit. We have we work with some creditor, but not care credit. So it kind of just depends on where you go.
Yeah, but don't be afraid of the pricing, guys. You can figure out a way to sort of finance it.
Are there options if you don't want to? Yes, there's other options if you don't want to get injections for scarring alopecia. I mean, again, injections are only a tool, right? You have for instance, there was a study on rosemary oil in comparison to 2% minoxidil that showed that they were very similar as far as efficacy is concerned. Everything depends on how bad your hair loss is, what the state of your actual hair is, and what side effect profile that you have. So injections, topicals, natural, vitamins, platelet-rich plasma, transplants. There are so many things that can be used for one particular person. Does hair oils with peppermint tea tree oil help with hair growth? There have been studies, particularly in mouse models with peppermint oil, as far as stimulating hair growth. So I do think that those things can be helpful. The only problem with essential oils is I think of all of these things as medicine, right? What are the doses that are appropriate to use? And somebody said castor oil. I don't know of any specific study on castor oil in people. Castor oil does have some good properties in it. But again, what are the doses that are going to be effective for the large majority of patients, right? We know that, for instance, 5% minoxidil works better than 2%. So is it 3%, tea tree oil that we use? Is it 5%, rosemary oil that we use? So I think we're still trying to work out those issues. I do think that they work. And, I'm from Ghana, so I love incorporating natural with the medicine as well. And so I think we just kind of have to find the right balance.
Dr. O, somebody asked about alopecia treatment for pregnant women. Is there something that's safe?
Yeah, so I mean, I think that most of the time depends on the type of alopecia and, talking it over with the OBGYN. You can probably use a topical cortisone. You can't really use any of the oral medications, and the injections are sort of questionable. So sometimes we have to table it. PRP might be one of the things that we can do. Sometimes if somebody knows that they're going to get pregnant, I may think about doing PRP on them like a few months before, a series of PRP treatments on them that carry them over. And then once they deliver, because 3 to 6 months after you deliver, you can have a type of hair loss called telogen effluvium, where the hair starts to shed. And so sometimes we can mitigate that with platelet-rich plasma as well.
Just out of curiosity, do you find that pregnant women have an advantage with their alopecia? Does it ever get improved from all the pregnancy hormones and everything?
Well, pregnancy hormones do increase the percentage of hairs in the anagen or growth phase. And so that can be helpful. But, a lot of that is reduced after you deliver, and all of those hormones are diminished and the hairs go back into the telogen phase all at the same time. Or at the end stage of CCCA. You know that when it's shiny and smooth. So yeah, that's when you know it's at the end. And just don't get to that point, because at that point, there's not much that we can do to help you. If it's smooth and shiny, that means that a scar has replaced your hair follicle, and there is nothing you can do to get that hair follicle to come back. So I'm begging all of you, go seek help early. There are too many things out there that we can do to help you. Don't wait until the end. Don't cover it. It's not worth it. No style is worth you not having that level of options when you get over time. So just go seek help.
Honestly, if I wasn't plugged in with you, I would not have gotten my CCCA diagnosis so early.
Right.
And started the treatment before I really had a problem.
Right.
So
right.
The early days, this is CCCA, guys. This is still, you know what I'm saying? So I just feel like it is treatable and best caught super early.
Yeah. All right. Well, I think we have talked long enough. Ever?
But I hope it's helpful for
I hope it's helpful. We'll do another one. I'll bring on some other patients. Maybe.
No! I want to come back. No, I'm just joking. Please.
No. Next time, I feel like, hopefully the Rona will be gone and we can kind of sit together and maybe interview another patients. I think that you bring a lot of insight because you've been through this. And, I know you've been supportive. I've given, your number to several of my patients who wanted to do hair transplants. And I think you've been very helpful and sort of walked them through in a very loving way. So I appreciate you so much. And thank you for being transparent, because we've all been through it. We've all been through it.
Easier to do that because I have come to the other side. You know, if I were in the throes of it, I wish I could be, I wish I would have been brave enough to share, but you know, it's hard for sure. Yeah.
All right. Thank you.
Thank you, Dr. O. Be
Everybody,
well. Be
so
safe.
much. Bye.